Hello and welcome to the Digital Dose, a podcast brought to you by EBO. We're here to unpack conversational AI for healthcare with a special focus on the NHS. I'm your host, Trudy Kerr, and in each episode, I'll be joined by Richard Samuel, our go-to expert on all things health and tech. Together, we will explore how AI is impacting patient experience, supporting clinicians, and reshaping the future of care. Richard, hi!
Hey, Trudy, it's great to be here today.
It's really great to be talking to you, Richard. Thank you so much for joining me. And I'm really excited to be exploring this topic with you. And what an expert to be sitting down with. So our very first episode is about enhancing patient engagement with conversational AI. And it's really at the forefront of conversation right now. But at its core, it's really about meeting patients where they're at, making digital feel human, and creating space for better experiences across the care journey. Richard, what is conversational AI and how on earth does this transform patient engagement in healthcare, particularly within the NHS?
Well, I'm passionate about the application of technology in the health setting, but I am an NHS manager through and through. I've spent my whole life leading and transforming services. What I'm not is a AI coder and expert, but I know enough about healthcare. I know enough around AI to fuse the two to see where the value lies. And that's my special ingredient in terms of what I've brought into my role in the NHS in national and local settings, and where I bring now in my role in transforming healthcare through technology. But it might be worth starting with, what do we mean by conversational AI? Artificial intelligence is one of a branch of AI designed to simulate human-like conversations. And it's experienced this extraordinary growth over the last 2 to 3 years, unlocking capabilities that we previously thought were years away. It uses natural language processing, which is an approach of a branch of AI which effectively is designed to understand, generate, and manipulate human language, and machine learning, which is a capability of artificial intelligence, which is to process a raft of data and learn from the responses to that data to enhance its capability. So bringing those two together, it effectively allows AI and computers to engage with individuals, with patients in this instance in the health sector, in ways in which that mimic the way in which staff, be they clinicians or administrators, would engage with those individuals in a one-to-one conversation.
This is really astounding.
It is brilliant because today, the traditional digital solutions we use effectively remove that human touch from digitalized pathways. They're free of empathy. If someone feels upset, what's the expression? The computer says no. Well, that was how traditionally digital interactions with patients played through. If you didn't fit the algorithm, then it wasn't responsive to you. Conversational AI restores the empathy in interactions between the patient and the service.
Okay, you've just touched on this idea of empathy. So I'm going to come back to something that you said recently. You spoke at a Digital Health Rewired conference, and something stood out that was your focus on psychologicalization of digital engagement. What does that actually mean as part of this conversation with patients?
So conversational AI allows the service to understand both the content and the context of any question or response that a patient might give. So it kind of helps conversational flows as well as emulating human dialogue. So if someone is upset and frustrated, then conversational AI is able to recognize that and helps find a way of addressing their frustrations or cause of concerns, rather than simply ignoring both the context or the frustration or the emotion that might have been expressed by the individual. It is also able to be much more dynamic in understanding both the questions or the conversation as played. So if someone says, I smoke cigarettes, as an example, we can hear that using conversational AI, and we can help them to navigate to smoking cessation services. But we can do so in a way that uses behavioral science and nudge theory to help people understand why reducing smoking or giving up smoking ahead of potentially a surgical operation may well add value to that individual, and therefore increase the likelihood that they are going to give up smoking. So it's all about creating context. A value of conversational AI is its agility. So imagine a world where someone whose first language is not English starts a conversation in English but can't express themselves fully and chooses to switch to, let's say, Polish, and continues the conversation in Polish. Conversational AI can see that shift and continue the conversation in Polish seamlessly to allow individuals to feel much more engaged. So in that respect, it kind of really removes this kind of barriers to access of digital literacy. It can be much more inclusive of the level of reading age of individuals, of their literacy, of their confidence of engaging. In many cases, we send out letters to people, and for some communities, their reading age of, maybe between 8 and 12, and yet letters tend to be quite complexly written in English in a way which can really isolate people and reduce their ability to engage in the conversation that's being had.
So many things that you've just said, Richard, have really blown my mind. This idea of being able to be sensitive enough to understand that somebody has switched into another language, but also to be able to engage with empathy, whether it's machine learned empathy or whether it's generated empathy or not, that still helps to diffuse frustration on behalf of the patient. People can be quite emotive when they're having these conversations because they're talking about something that is incredibly important to them, which is their own health. We've talked about amazing things that conversational AI are doing right now, but what are the biggest challenges and opportunities when it comes to embedding conversational AI into patient engagement strategies in the years to come? Because I think that's what a lot of people will be concerned about.
So before I retired and left the NHS, I was part of a program which was called Mobile First, and we were driving the digitalization of interaction between the citizen and the NHS. And that for many people, that will appear as the increasing capability and functionality that we're offering to people through the NHS app and the NHS website. So the ability to book, amend and cancel appointments, the ability to view letters through the NHS app. So a raft of what I would call kind of transactional capability. If you want to kind of book a hotel, or you want to receive your confirmation of the invoice, or you want to, that transactional capability. And I'm really proud of my part in that work and the work that's been done. And it's created a great foundation for the future. But we've only just started. As we move into a world where the NHS has set itself the ambition that a third of all patient interactions with the NHS are delivered digitally in the next 5 years, then that sets some extraordinary challenges. Imagine that, a third of all interactions. So for every man, woman and child and their interaction with the NHS, a third of those interactions will be digitized. 120 million outpatient appointments. Each of those outpatient appointments will generate, let's say, 5 interactions. So you can just do the number, 500 and 600 million interactions just for outpatient services alone, and a third of all of those will now be digitalized. And as we get more sophisticated about these interactions, we're not just digitalizing transactional interactions. We're starting to do things like assessments, triage, collecting information from people to triage before appointments, patient-reported outcome measures, patient-reported experience indicators. All this work replacing in-person interactions, what used to be done by an administrator or clinician, now being done by an individual interacting with a digital solution. And as we move down that track, we have to become obsessive over the quality of these interactions and the capability and motivation of individuals that we're engaging with. Otherwise, we will create this world of frustration. We all know the experience of interacting with bad technology and bad digital solutions, right? It's the kind of one of the big world life's frustrations. But if you live in the UK, for example, I'll call this out. I genuinely find doing my car tax now a pleasure compared to what it was. It's a 20-second job to do my car tax renewal, or car insurance, anything where we know intuitively this is easy to do and allows us to capture quite a lot of complex content together is where we need to get to. The challenges are that we underestimate how we have to take a design-led approach to delivering high-quality interactions with individuals. Instead, we just build one way. It only works for people who speak English, have good digital and literacy, have a good reading age, are assertive and motivated, and have a mobile phone. And suddenly we're excluding large swathes of individuals, many of whom are the most in need of accessing health services in England. People actually do want to engage with technology that addresses their needs. They want their problem solved or their question answered in the most expedient way possible. And conversational AI now has the capability to achieve this. So the challenges are this kind of poor design or understanding of conversational AI and its place in the new healthcare market, and a limit in the ambition and excitement and capability of organizations and systems to embrace this new technology.
I have to throw another question in there that came to mind as you were speaking, because yes, of course, doing a car tax online and speeding up that process is brilliant. But if you don't manage to get your car tax or something happens, it's not the end of the world. Whereas with regards to healthcare, for a lot of people, trying to be able to get into the healthcare service that they need to is incredibly important. So can I just check with you? Because I'm asking a question that a lot of people will want to ask. What is the reliability of engaging with conversational AI or any technical services when it comes to healthcare?
We would never advocate a one-size-fits-all approach. We would always advocate a hybrid approach to delivery of services. So there will be, for some people, they genuinely don't want to engage down a digital channel, and therefore you would always create multiple avenues of interaction. And that will remain the same in perpetuity, the same way every other sector thinks about it, that you have to afford individuals different channels. For many people, however, they feel very confident with the idea of well-designed self-service digital interactions. And I can talk about some of the value and benefits that patients find in this, but almost always creating a bit of an emergency button that you can press if you feel as if it's not fulfilling your needs, and that you can lift yourself out of a digital self-service or interaction channel and into an in-person interaction with a human. And those are some of the safeguards that we create. I think the other point you kind of talked about, the safety of these processes. What's interesting is that we overstate the consistency and structure of how existing approaches work. So we've done quite a lot of process mining, we call it, where we've looked at how current operational systems and processes work in healthcare. And what we would observe is that there is a very large amount of variation, in many cases unwarranted variation, between teams, individuals within teams, departments, specialties, hospitals, systems. And actually sometimes the application of design-led digital interactions reduces that unwarranted variation, because with unwarranted variation can actually create a poor experience and some safety concerns and challenges. So we need to be really thoughtful. Our ability to digitalize content isn't constrained. Our ability to integrate the outcome of the digital interactions is, and therefore you need to make sure that if you are, for example, digitalizing an assessment, you need as an organization, or we need as a tech supplier working with organizations, to be really thoughtful about how you induct the outcome of that assessment seamlessly into the clinical workflow. Tech is not a silver bullet. Tech without design can create risks and concerns. Technology augmenting well-designed clinical pathways and integrating seamlessly into clinical operational workflows is one of the greatest transformative capabilities that we've seen in the last decade to 20 years. And AI only opens the door to an acceleration of that opportunity. But it has to be done thoughtfully, and it has to be done in a kind of design-led approach.
Richard, I love the way that you framed this, and it's definitely getting me to rethink about my preconceptions regarding AI, conversational AI, and any tech services relating to healthcare. Because, of course, immediately we jump to the assumption that maybe a tech solution is not safe, but we eliminate in our brains when we're doing that the fact that humans are also fallible and there's a huge potential for things to go wrong. But I loved also what you said there, Richard, about the fact that there is design and thinking behind the systems. And I think that's so crucial.
I'd love to give you an example. We were working with an organization that had introduced digital forms to replace a clinician interacting with a patient. In this instance, it was around preoperative assessment. So typically what used to happen is a nurse specialist would sit with the patient and talk through a range of questions about the individual's health and their needs, and they would make a determination as to whether the individual was safe for surgery or whether they needed to sit down with an anaesthetist and have a full workup to determine their needs for surgery. The organization replaced that set of conversations between the clinician and the patient with a form. Simply just took the questions that the nurses were asking, turned it into a static form, and then asked the patients to complete it. And the logic being that patients would complete it in their own time. They'd send the form through to the nurses. The nurses would then review the form and either clear the patient fit for surgery or refer them to the anaesthetist for their more detailed workup and assessment. So that was the kind of logic. And the view was that by doing that, the organization would be able to see double the number of patients, because reviewing the form will take far shorter than having that kind of half an hour interaction per patient. In reality, because there was no support for the patient going through the completion of the form, that there was no quality control around the content being put into the form. It presumed that patients understood the questions. There was no adaptive literacy and inclusion levels. It assumed that the patient could access the internet. What actually was found in the organization was that a lot of the forms were coming back incomplete or poorly completed. The content wasn't as clear as was required. The nurses, who actually had quite a fulfilling role of engaging with the citizen and adding value and helping direct them to smoking cessation or weight management services, or advising them on how they can optimize themselves for surgery, were now spending their time at a laptop, at a screen, reading through content, and then finding themselves then having to phone up patients and explain why they hadn't completed the form correctly and why they needed to do it. So not only did the organization not see an increase in throughput of their preoperative assessments, but the patients were frustrated in that they had to complete long forms without support. The nurses changed from a role of adding value to people, helping them to understand about preoperative assessment and where they can add value, to being frustrated to reading forms on a computer. And that's just an example of where poor design and implementation has resulted in the worst of all worlds: poor experience, poor job satisfaction, poor productivity. And I'm not saying that conversational AI in and of itself is an answer to that, but it is undoubtedly design-led CAI brings real value, allowing individuals halfway through the form to press the emergency button and say, I don't want to complete this. I want to now talk to the nurse specialist and have a conversation. So that for me is a prime example of the risks of poorly deployed patient interaction using static, binary, forms-based, non-dynamic interactions with a community that is as diverse as any in the NHS. Conversational AI, in its ability to do things which we didn't think were possible even 2 to 3 years ago, is not the only interaction. There still remains an important place for transactional digital capability. Take patient portals. The ability for people to book and amend, cancel appointments remains critical and important. The ability to surface letters, the ability to view appointment schedules, that remains critically important. Where conversational AI brings this extraordinary augmentation is to help individuals navigate through some of these solutions, to help them build an understanding of what they might experience when they come in for their appointments, or gather information from them before they're in their appointments in a way which genuinely drives productivity, greater patient experience, and greater organizational value. So we're not saying throw out your existing capability. We are saying augment your existing capability with conversational AI, because it's here and now, and it's an extraordinary technology that has unprecedented impact and value for the service.
Richard, I cannot thank you enough for shedding light on this topic that is very emotive and affects every single one of us. And thank you for taking part in our very first episode of The Digital Dose. If you've liked what you heard, make sure you follow or subscribe, and stay tuned as we bring you more stories, insights, and guests to your ears. Thanks for listening, and we'll see you next time.